What's up, my people? This is Mr. Cash, and we're going to continue the chapter of mechanical ventilation. We stopped at the understanding of the tidal volume, and I wrote here a few notes about the tidal volume. What is the tidal volume? Tidal volume is a measured volume of air during inhalation or exhalation. What it means is a tidal volume. From now on, I'm just going to be using VT for tidal volume. And what tidal volume means is this is your lung, the amount of air that enters your lung. Let's say 500 ml of air goes into your lung during normal breathing, which is a normal inhalation and exhalation. A tidal volume, you will not even to notice it when somebody is breathing until you tell them to take a tidal volume. It's an inhalation and then an exhalation. So you have inhaled VT and exhaled VT. So inhaled tidal volume and exhaled tidal volume. I want you to remember this number right here, 500 ml, because this will keep coming at all times. So let's continue reading with the chapter. And please, if you don't understand anything, post down in the comments below, or send me at my email a message, and I'll try to explain furthermore. Let's continue here. Ventilation is a cycle, or let's learn. We could say let's learn. Ventilation is a cycle. This cycle has two phases, inspiration and expiration. During each cycle, a volume of gas moves in and out of the respiratory tract. This volume measured during either inspiration or expiration is called the tidal volume. The VT refreshes the gas present in the lung, removing CO2 and supplying oxygen to meet metabolic needs. So what does this tidal volume do? Okay, now let's see what is the main function of the VT, tidal volume. So what is the main function of the tidal volume? As we read in this sentence, what it does is you have 500 of ml of air that is from the outside This 500 of air has fresh oxygen, O2. O2 stands for oxygen, correct? And then CO2, which is a byproduct that is produced in the blood. So CO2, so you inhale, your tidal volume delivers oxygen, and then the exhaled tidal volume will take out the CO2, correct? So we inhale, take a deep breath in, we take oxygen in, which is taken by this 500 ml during normal breathing at rest. Remember, when I take a deep breath, that's a different type of volumes it's going to be. I'm going to show you later on in this chapter. Just remember that a tidal volume, just an inspiration and an inhalation and exhalation during a normal state at rest, not exercising or being sick. So the CO2, the oxygen goes in, and then the CO2 comes out. So that's the main function of the tidal volume, is to bring in oxygen, fresh oxygen, and take out the CO2. Let's continue reading. The tidal volume refreshes the gas present in the lung, and they refer to it as gas, which is air, same thing, removing CO2 and supplying oxygen to meet metabolic needs. The tidal volume must be able to meet changing metabolic demands, such as during exercise or sleep. So when you exercise, your body the metabolic activity is higher, which means that your body is taking more oxygen and taking out more CO2. And when you're asleep, that you at rest, the metabolic activity decreases, which just goes down. So when you're running, you start to breathe more deep breath. You take in and you exhale heavy, right? And you breathe in more air and you let out more air. So during sleep, your oxygen demand or your metabolic demand is low. So let's say if you are sick, you're breathing heavy. It's the same thing compared to exercise, because your metabolic needs to do more. So you will need to take more oxygen. And then you want to get rid of the CO2 that is produced, because the metabolic activity in the body is high, so more CO2 is produced. Okay. To achieve ventilation, the respiratory muscles or mechanical ventilator have to generate changes in pressure. A pressure gradient is a later discussion. Okay. So that gas will flow on in or out of the lungs. To better understand the forces that the muscles or the machine have to overcome to generate ventilation, we use a formula. This formula is specified version of the equation of motion of the respiratory system, which is change in pressure, elastance by volume plus resistance and flow. Now, what is pressure? Change in pressure. Pressure is a force generated by the respiratory muscles or mechanical ventilator, or both, during inspiration. The pressure is actually a pressure difference seen in the next section. Okay. Volume. Change in volume. Remember the tidal volume that I said 500. Remember this tidal volume. Elastance. Distensibility of the lungs and thorax. Change in pressure over the change in volume. Elastance is the reciprocal of compliance, volume and pressure. Resistance, airflow, and tissue resistance, pressure and flow. What I want you to remember here is compliance. I'm going to put a C for compliance, and we're going to say compliance is what? Reciprocal of compliance. So here they said elastance, distensibility of the lungs and thorax, which is pressure over volume. Elastance is the reciprocal of compliance, right? So compliance is going to be what? Volume over pressure. Volume over pressure. Correct? Remember that compliance is volume over pressure. Flow. Flow is what? Volume change per unit of time. In this equation, the terms elastance times volume and the resistance times the flow represent the loads elastic and resistive against which the respiratory muscles of the ventilator must work to achieve gas movement. Thus, you can now see that in patients with high elastance or high resistance, the pressure needed to achieve ventilation will be high. In healthy lungs, this work is minimal and is performed during the inspiratory phase. Expiration is normal, passive, and muscle force involved in the results of the elastic recoil of the lung. So what I want you to understand from this whole paragraph is one simple thing. What they're talking about elastance, volume, you need more pressure, is you see this as a lung, right? Let's say you have a balloon that you have not inflated yet, right? When you first blow into that balloon, it's hard to inflate it. So you need a higher pressure, a higher force, and the flow is going to be low. to inflate it, right? So you need a higher pressure. So your lungs are the same thing. But when the balloon is already inflated and it's already about this size, it's easier to blow and the balloon goes up. So that means it has high compliance. So patients with COPD, where they have the alveolar walls are damaged, they have a high compliance. And patients with fibrosis, they have low compliance because the scar tissue that is around the alveoli is making it very tough to inflate them. So COPD patients don't need a higher pressures to inflate the lungs. Well, if you see patients with ARDS, where the lungs is full of fluids, they need a higher pressure to inflate the lung. And remember, we're going to get to that in later chapters. You don't want to inflate the lung too much, because if you have a balloon and you keep blowing into it, you're going to cause it to pop. So you need just the right, the right perfect amount of volume that is going there. Just the adequate air. You don't need too much nor too little. So this is what I want you to understand from this here. Now let's keep going. In discussing ventilation, it may be helpful to review some details about the equation of motion. First, remember it is a mathematical model. You understand here? So every time you read these respiratory chapters, please read the paragraph and try to understand it. What are they talking about? Because when you understand about the patient, it's all about the patient. When you understand what they're trying to tell you, you will get it and you will never forget it, and you don't have to review all this back. So they're telling you here just a mathematical model. Do you need to understand this equation? Yes, you have to. But I don't want you to focus too much on these numbers, volume, or pressure. Just remember, you have to be able to compare what they're talking about. In discussing ventilation, it may be helpful to review some details about the equation of motion. First, remember it is a mathematical model. This model lumps all the resistance of many airways into a single flow conducting tube and lumps all the elastance of the alveoli and airways into a single elastic compartment. See later discussions about elastance, compliance, and resistance. The graphic model is shown in figure 11.1. This is the graph model they have here. We're going to look at this graph and we're going to try to explain what's going on here. Surrounding the lungs is another elastic compartment representing the chest wall. This graphic depiction of the respiratory system allows us to define points in space where pressures may be measured or inferred as defined in table 11.1. Okay, now let's try to understand here. So we're gonna go over this graph. I wish I had a balloon. I can explain it better with a small balloon, but hopefully next time I'll get a balloon to explain it better for you guys. But I'm gonna try to do my best to make you understand this. Okay, so let's see the first pressure that we have, right? We have the airway pressure, right? And you have the table right over here. Please, when you are going over this video, have your chapter right in front of you so you can understand where I'm at. So let's read what's going on. So graphs, understand one thing. If you see this on a chapter, they did not put it there for fun. This means a lot, and most of the time, whatever paragraph is here in this is going to explain this. So remember, pay attention to those. Don't just skip over them, please. Okay, let's start reading here. So let's first understand what's here. So this one is pressure at the airway opening. Pressure measured at the opening of the respiratory system, airway, mouth, nose, tracheostomy opening, and endotracheal tube opening. Correct? So, PAO stands for airway pressure. So, you have a patient, right? So this is the mouth of the patient, correct? This is the mouth of the patient. So the airway pressure that is here, I'm sorry, it's not a good drawing, but I'm gonna try to make it. So the pressure, this is the mouth, right? Correct. This is a mouth that I put here. The pressure that is here is called the airway pressure. Airway opening pressure, correct? This is the pressure at the airway. If you have an ET tube, which is an endotracheal tube, a tube that is all the way into your trachea, I'm sure you understand what's an ET tube, but they normally put ET tube, okay? The pressure at the EET tube is the same pressure at the airway opening, but now since there's a EE2 tube, that means the airway pressure they're not gonna measure at the mouth, because who's breathing now? You're breathing through this ET tube, correct? Now, if you don't have the ET tube, you have a tracheostomy tube, which is right here, normally on your neck. There's a stoma. It means an opening in your neck, and then there's the tube that goes here. It's called the tracheostomy tube. Now the pressure is going to be measured here. So wherever is the opening that is going through the tube to the lungs, to your lungs, is the airway pressure. So now I hope you understand. This is what they mean here, where they said the airway pressure is at the tracheostomy tube, at the endotracheal tube, or mouth and nose. Of course, mouth and nose is because when you are breathing normally, when you're healthy, you're breathing through your mouth and nose. So this pressure is at your mouth and nose. But when you have a tracheostomy tube, it's only at your tracheostomy tube because there's only one opening and it's inflated. We're gonna go. I don't want to go too deep into that. And if you have an endotracheal tube, you are intubated. That means the pressure there. Okay. Now let's go to the second one. So airway opening. Okay. Airways. The airways is here. So if you are intubated, your airway is the ET tube, and if you have a tracheostomy, your airway is the tracheostomy tube. Then you have the pleural space here. This is the pleural space, right? The purple. This pleural space is between your lung and your chest cavity. So that means this is your lung and this is the chest cavity. The pleural space is between your chest and your lung.